my name is Reagan Brooks. I'm a student nurse here at the University of South Alabama, and today I'll be performing my medication administration check-off. So, I'm going to sweep the room first. Today I'm working in my kitchen. And next thing I'm going to do is go ahead and just explain some basics of medication administration. So firstly, I would make sure that I'm in a distraction-free zone, and I would not accept any phone calls, and I would limit conversations with my colleagues unless it was really important or it had something to do with the medication administration. I'd also make sure that my medication door is shut. So now I am going to go ahead and move on to comparing my MAR with my patient order form. So to do that, I'm first going to check the name, Jones Jaguar J, Jones Jaguar J, check the medication, Novolin R, regular insulin U100, Novolin R, regular insulin U100. I would then check the dose, 10 units, route subcutaneously, time 30 minutes before meals, time 30 minutes before meals. The indication is to regulate blood sugar, so that's how he's taking it 30 minutes before he's eating. And documentation, all aspects of a legal prescription are here. We're lastly going to check allergies, penicillin, allergies to penicillin. So now that we are finished with that, I can go ahead and move my order form out of the way. And I can start my first check with just the MAR. So I'm going to perform hand hygiene. And I'm going to begin by checking with the patient's name, Jones Jaguar J. And next, I'm going to check the medication. Novolin R, regular insulin, U100. So from these 4 vials, I would choose my Novolin R, U100, regular insulin. And I would hold it up, Novolin R, regular insulin. All right. I would also check the expiration date, 12/1/2025. 12/1/2025. And then I would move on to the dose. So for the dose, they need 10 units. So I will be using my 50-unit insulin syringe. They are also receiving it subcutaneously, so this is a perfect syringe to give subcutaneously. It's a 1/2-inch needle. So we are going to go ahead and unpack our needle. And then we will begin by pulling back. Well, first I'm going to clean the top of my vial. This is a U100 vial, so I will be able to pull 10 units out of this. I will go ahead and uncap my needle, set the cap right here, pull back 10 units of air. I'll let you see that. 10 units. I will go ahead and pop that into the insulin, push the air in, and draw out 10 units of the insulin. Here we go. All right. So now that I have 10 units of the insulin, I'm going to go ahead and pull that up just so you can see 10 units. And I will pull that beside my MAR, 10 units. Subcutaneously, I can use this. In time, 30 minutes before meals. It is about 30 minutes before Mr. Jones's next meal. And for indication, this will help him keep his blood sugar regulated. All levels of a properly documented prescription are here and present. So next, I will move on to my second check of the 7 rights of medication. So first, I will start with the name, Jones Jaguar J. Next, I will check the medication, Novolin R, regular insulin, U100. Novolin R, regular insulin, U100, expires 12/1/2025. 10 units. Subcutaneously, this is a good subcutaneous needle. Every 30 minutes before meals, and it is 30 minutes before his next meal. Indication to regulate his blood sugar, and documentation, all legal aspects of a prescription are here. So we're going to go ahead and make a label for this medication. So I'll need to pull off some tape. And on the label, I'll include his name. The medication, so Novolin R insulin. And the dose, which is 10 units. And I'll go ahead and put that on my vial, and I'll put it under the numbers that I'm working with. Alright, so now that that's on there, we have the patient name, medication, and dose right there on the syringe for safety. So now that we've finished that up, we can go ahead and move in to our patient's room and get ready for check number 3. So we are going to move into my patient's room over here. And I'm going to begin by just performing hand hygiene and checking the name and MR number first. So, right patient, beginning my 3rd check of the 7 nights of medication. Jaguar Jones J, Jaguar Jones J, MR number 4176352, MR number 4176352, date of birth 08/25/1963, date of birth 08/25/1963. So, allergies to penicillin, allergy to penicillin. Did you have any other allergies you needed to talk about today? No? All right, perfect. So now that we have checked the armband and the MAR for the right patient, we're going to go ahead and move on to the right medication. So now we have 2 things to check against the MAR. We're going to check the Novolin R regular insulin vial, Novolin R regular insulin, and check the tag that we have made for the syringe, Novolin R regular insulin. Alrighty, 10 units. Says on the label 10 units, and I can see in the syringe that there is 10 units. Subcutaneously, this is a good needle for subcutaneous injections. 30 minutes before meals, it is 30 minutes before his next meal. An indication is regulating blood sugar, so this is perfect to take 30 minutes before his next meal. Documentation, all legal aspects of a prescription are here and present. And so we will be able to go ahead and move on to the injection. So I'm going to perform hand hygiene one more time. I'm going to apply clean gloves and my goggles. And I will begin by cleaning the injection site. So we'll start in the center and move in outward circles and dispose of that. And we will go ahead, goggles. And we will go ahead and pick up that syringe, slide back the safety. And since it is subcutaneous, I'm going to pinch a little bit of fat here, and I will go in at about a 45-degree angle. If you can pinch 1 inch, if you can pinch 2 inches of fat, you can go at a 90-degree angle, but since I'm only getting about 1 inch here, I'm going to go at a 45-degree angle. Alrighty, we will not aspirate when giving insulin. Perfect. Slide that back up. Get my sharps container. That goes in there. I will go ahead and also apply some pressure. Very, very light pressure, and do not massage with that alcohol pad. And then I will remove my gloves, glove to glove, skin to skin, and dispose of those. Take off my glasses. I would lower the bed back to normal height earlier. I cannot remember if I stated that I would raise it, but I would have raised it. And I would lower the bed back to a normal height and exit the room. I would come back to check for any allergies, allergic reactions or anything like that later on with the patient. And that concludes my medication administration checkoff.